According to experts, children participate in a number of occupations, like learning and playing, amongst others. But sometimes they are unable to carry them out due to developmental delays or learning difficulties.
So learning difficulties are actually a neurological concern where there's something impacting on that child's ability to learn. So often those children are not able to process information properly, whether it be through their sensory systems, and then they can develop a learning difficulty which will impact on how they might read or how they might spell. Whereas a developmental delay is more the child is delayed in terms of meeting their milestones that other children are meeting as they grow and develop.
Emma Guthrie is a local pediatric occupational therapist who has been helping children meet their developmental goals. With the right therapy and the appropriate stimulation input, she says, children are able to independently participate in their occupations. Some children have weak finger muscles, which hinders them from grasping onto something as simple as a crayon.
Our therapy session will look at the challenge the child is having and then try and break it down into the skills or components that the child needs to be able to do that task. And we use play and toys in a very therapeutic way in order to achieve those goals.
Sometimes, kids have difficulty processing information from their sensory systems like eyes, ears, or through moving or touching. As part of the therapy, kids are exposed to sensory stimulation, allowing the brain to adapt, which in turn helps them to process and react to sensations more efficiently. Activities like a balance challenge or moving in a swing and even being exposed to certain sensory inputs are an extremely fun way of carrying out the therapy. Even though more parents and guardians are taking their children to private occupational therapists, Guthrie says the profession highly depends on supporting the parent.
And occupational therapy can be very practical. It doesn't need fancy equipment. It doesn't need fancy rooms. It can actually be done under a tree, to be honest, because a lot of what we do is parent education, parent support, caregiver support to try and assist that parent, because ultimately they are the therapists at home.
Ideally, occupational therapists should be found in all Namibian schools to assist learners, but the Ministry of Education does not have them. The Ministry of Health only has 18 occupational therapists countrywide, including 2 chiefs and 3 assistants. The occupational therapy profession in Namibia is about 30 years old, and UNAM's medical school will be graduating the country's first 7 occupational therapists in April 2022. Francis Shahama, NBC News, Windhoek.